Amniotic-derived fluid is an ambient temperature liquid allograft derived from the amniotic components of the placenta to advance soft tissue repair, replacement, and reconstruction. The product is classified as minimally manipulated under the FDA. The donor of the donated human tissue has been deemed free from risk factors for and clinical evidence of infection due to relevant communicable diseases and other exclusionary disease conditions through the review of the donor's medical records, including medical behavioral risk assessment and recent physical examination. The donor is deemed eligible for tissue donation by the tissue bank's medical director, and the donated human tissue has been determined to be acceptable for transplantation use through a stringent quality assurance review process. Amniotic-derived fluid contains an impressive array of regenerative factors. There are no live stem cells, dead tissue, or debris in this product, as the FDA does not allow for stem cells to be present in any amniotic-based product at this time. The product is intended to enable your body's ability to repair itself by recruiting your own cells to do the work. This powerful liquid is derived from the amniotic membrane, which is rich in nutrients, growth factors, and other proteins to help develop the fetus in the womb and support healing in humans. The product is offered for therapeutic and aesthetic applications. It contains over 200 growth factors, cytokines, and other active peptides beneficial for regenerative tissue repair. Of note, there are certain growth factors contained in amniotic-derived fluid which play a crucial role in repairing damaged tissue. Epidermal growth factor, platelet-derived growth factor, and transforming growth factor beta-1 are all growth factors which stimulate cellular growth and differentiation. Fibroblast growth factor basic, angiopoietin, and vascular endothelial growth factors stimulate blood vessel formation. Matrix metallopeptidase 9 is a growth factor that stimulates tissue remodeling. Tissue inhibitors metalloproteinase 1, 2, 3, and 4 are growth factors which decrease tissue remodeling, which is important for regulating appropriate remodeling. Myeloperoxidase is a growth factor which stimulates antimicrobial activity. And interleukin-10 and interleukin-1 receptor antagonists are both growth factors that have anti-inflammatory activity. Interleukin-10 helps block the activation of macrophages and dendritic cells. Amniotic-derived fluid products have several clinical advantages. It's a safe, non-steroidal alternative to surgery. It's anti-inflammatory and antimicrobial. It's all-natural and drug-free. It reduces patient recovery time, and it contains more than 200 growth factors. Amniotic-derived fluid is designed to treat a variety of conditions, including wound care, soft tissue and cartilage repair, aesthetic rejuvenation, respiratory, and vision. Physical medicine clinics such as orthopedic and sports medicine use amniotic-derived fluid to treat degenerative joint disorders such as sports injuries, osteoarthritis, and joint pain. Also, inflammatory conditions such as bursitis, tendonitis, and fasciitis, as well as soft tissue injuries such as ligament and tendon sprains, muscle and meniscus tears, and wound care. In the aesthetic space, amniotic-derived fluid is typically used for microneedling procedures, facial rejuvenation, hair restoration, non-surgical facelifts, and sexual rejuvenation. The AmnioBreathe nebulizer bundle is designed to deliver the amniotic-derived fluid as a topical directly onto the patient's respiratory system. Similar to its use for other conditions, the natural growth factors and cytokines that are present in the amniotic tissue help regenerate soft tissue while inhibiting inflammation and scar tissue formation. The application of the amniotic-derived fluid through the nebulizer has been shown to help patients suffering from COPD and other respiratory conditions. In addition, the AmnioBreathe nebulizer has been used as a general wellness treatment by systematically circulating the growth factors and cytokines throughout the body to help repair and replace damaged soft tissue. The AmnioVision kit is especially useful in the ophthalmology space. Amnion contains growth factors that promote epithelial wound healing on the surface of the eye. Because it's anti-inflammatory and anti-scarring, it makes it extremely beneficial in a surgery setting. It's also available for immediate use off the shelf. It's stored at room temperature. It adheres well to the ocular surface, it hydrates quickly, and it's dual-layered for more tensile strength. Flow amniotic-derived fluid has some unique features that make it stand apart from many of the competing brands. First is the ease of use. The product is provided in a vial as a ready-to-use, flowable allograft with no thawing or prep required. In fact, unlike many competing stem cell products, these products are stored at ambient temperature between 50 and 86 degrees Fahrenheit. This means serious savings to the practice, not only in terms of time spent in preparation, but reduced spoilage or mishandling of the product. The liquid amnion is provided in an easy-to-apply, flowable form for precise delivery throughout the intended site. The product is provided to the practice in a sterile vial in a clear peel pouch which may be introduced in a sterile field. These regenerative products are highly lucrative for physicians and reps alike. The market for regenerative products is expected to grow by 5 times by 2030 according to some estimates. Both aesthetic and therapeutic procedures are surging with demand, and doctors can typically profit anywhere from $3,000 to $10,000 per procedure, with reps earning anywhere from $200 to $1,000+ per procedure. Check pricing sheets for up-to-date pricing on each item. If you would like more information about adding this or any other program to your sales portfolio, you can sign up directly by visiting everyancillary.com. You may also subscribe to our YouTube channel to find other medical sales training videos. To stay on top of all the latest medical ancillary programs and industry trends, you can also subscribe to the Medical Ancillary Sales Podcast and Medical Practice Trends Podcast. Of course, you can also follow us on Twitter, where you can find the most up-to-date information about the medical ancillary sector, so you can stay a step ahead of the competition. Our Twitter handle is everyancillary. Links to subscribe to each of these are provided in the video's description.